the question I had for Dr. Ghaly, it's sort of going back to a question we've talked about even the past week or two, but I saw that you cited it again in your article, which I almost thought should say schools should be opened with a big asterisk, because then you had, 5 or 6 points of the things that needed to happen for this to actually work out and to work out well, PPE and testing and the like. But the question that I really had is that you cited Germany, you cited Denmark, and then you cited Israel separately. And we've sort of gone down this road before, but in the case, obviously, in Germany and Denmark, it's worked out. In the case of Israel, it didn't. And there seems to be no scientific consensus about why that was, except for the fact that Germany and Denmark didn't have lots of spread and Israel did. So how many cities in this country do you think can't open right now because of spread?
Well, look, it is true that when we look at every other country, including Israel, they reopened against the backdrop of having crushed their virus. There wasn't a lot of spread. Israel didn't have a lot of spread at the time either, and then spread reemerged after they reopened their economy. The only country that had schools open against the backdrop of a fair degree of spread was Sweden, and so that's what everyone extrapolates from. We didn't study that systematically. We don't know how many kids were really infected. There weren't good seroprevalence studies done in that country, so we really don't know. We also can't compare the Swedish population of children to the U.S. We have more comorbid illness among young people in this country, more asthma, more obesity, more diabetes. And so there is going to be higher risk with our school-age population. But in terms of the situation here in the U.S., I've said this before, I think it's going to be very hard for certain states or certain cities right now to reopen on time. And in fact, you've already seen Arizona delay the reopening of their school, and they might have to do school system, and they might have to do it again. It's going to be much easier to reopen schools this fall in Massachusetts or Maryland or Michigan than in Miami or Houston right now. And I suspect some of these cities are going to have to delay their openings, even if they haven't affirmatively done that yet. Because when you're in a situation where your hospitals are overrun, your morgues are overrun, you can't get enough medical personnel, you're not going to take a step that on the margin is going to increase spread. I mean, you can't argue that opening the schools isn't going to have some impact on potentiating additional spread, even if it's just among the teachers. But the students themselves, the evidence shows that they are vectors. They may not be as robust vectors as they are when it comes to the flu, but they are vectors in some sense. So when you're right on the precipice where your healthcare system's tipping over, you might not be able to do this. And so the number one thing you have to do to reopen the schools is get your spread under control. That's what these cities should be focused on.